Hello, my name is Robert Polk, and this is clinical statement number 4 for ATTR 456. This semester I am with Indiana State men's basketball, and my preceptor is Connor Burton. Over the last 3 weeks, which included the spring break, I have completed 17 and a half hours. In addition, I've completed SIP 1 baseline patient data, SIP 4.1, 4.2, and 4.3 evaluation, therapeutic intervention, and modality use. And then SIP 8 is the only one that I have left, which is a psychosocial intervention. So just to kind of recap from these past 2 weeks, we came back for a week right after GLADA and really kind of hit heavy the off season, in quotes, I guess. So more so preseason work and planning for the preseason. So when we came back, we did a lot of the baseline data for the weight room, but then we were also starting to do the healthcare informatics, so kind of breaking down the injuries that occurred during the season and seeing how many of those were non-contact injuries versus contact injuries, how much of those were time loss injuries, and then if we could kind of see a pattern of lower extremity injuries that were non-contact, and if we then also need, based upon literature and then the healthcare informatics, if we need additional prevention and rehabilitation work for those patients. So one of the things that we collected in the weight room baseline data was the weight-bearing lunge test, which has very good evidence on it to show that a measurement below a certain amount predisposes you to lower extremity injury, specifically ankle injury. And that's due to kind of that Achilles tendon being taut and hypertonic and putting that patient into more plantar flexion than what would be neutral. The second thing that we've really been hitting in these last 2 weeks is a lot of organization and administration with kind of doing end of season physicals, end of season / beginning of season concussion baseline assessments, and just overall doing a lot of the closing of athletic injuries. So in the past week, we collected all the postseason patient baseline or patient healthcare screenings. So what that consisted of for the university is a 9-question survey. If there are any yeses that the patient reports, we fill out what the yes is. So one of the questions was, did you have any injuries during the season that caused you to miss time? Yes, what was the injury, type thing. And then we also, based on the history that they gave us, made recommendations in patient education guidelines for continuing to A, get better from injury if it hasn't been resolved, B, continue to monitor injuries, and C, overall preventative work on those injuries. So very important stuff that some of the players may never ever see an athletic trainer again, and their playing career could be done. So giving them this like healthcare advice for future reference is really helpful for them. And then I've had the opportunity to have an on-site interview up at community hospital. So that was a really interesting experience because the first on-site interview that I had, the overall went really well. It was just getting the first one under your belt is sometimes hard. So it was just a very good experience for me to have that and be under my belt and go well, and hopefully in the next week or two I'll be hearing something back from them with either an extended offer or not an offer. So hope it's an offer, but we'll find out. And then the last thing that I just kind of want to talk about is that because I ended my term with the GLATA and the IATA, I've kind of noticed that it feels like there's a little bit of a void going on in my athletic training world. So just going forward, I got to try and make sure that I find ways to keep staying involved in leadership opportunities, either at the state level, district level, or national level. Kind of based on it right now, probably more like state and district is where everything would fall into place, but I know I want to be active in leadership within athletic training, so just trying to find a way to get back into that and kind of get that piece of me that's missing back. So that was the last 3, but really 2 active weeks of my athletic training experience. Going forward, I'll only have one end of the year clinical statement video to post later that hopefully at that time I'll know a job opportunity, BOC, the results for that, and then all the other fun stuff that goes with graduation. So this has been clinical statement number 4. My name is Robert Pollock, and I hope you have a good day.